introduce our first trial, defining the prevalence of valvular heart disease in older Americans, the PREVUE Valve study that will be presented by David Cohen.
Thank you so much, and thanks for the opportunity to share our work with this incredible audience. The PREVUE Valve study has been a 4-year journey, and on behalf of my co-investigators, the steering committee, it's my pleasure and privilege to present the primary results of this study. PREVUE Valve was an investigator-initiated study that was sponsored by the Cardiovascular Research Foundation, and financial support was provided by grants from Edwards Life Sciences, Abbott, and Philips. And I should tell you that this is going to be unlike any clinical trial you've ever seen presented here at TCT, and I hope you will enjoy it as much as we did. With the aging population, the incidence and prevalence of valvular heart disease are increasing in the US and the developed world. And despite the introduction of novel treatments for valve disease, patients often remain untreated or are treated too late to influence outcomes. In order to optimize screening efforts and improve patient access to these important therapies, it's essential to understand the prevalence of valvular heart disease. And although this has been studied for about 30 years, virtually all of the prior studies have important methodological limitations that really preclude an accurate assessment of the prevalence of valve disease in the United States. To overcome these limitations, we designed the PREVUE Valve study with 3 specific aims. First, to define the prevalence of valve disease and its subtypes among older Americans. Second, to determine the influence of age, sex, race, and ethnicity on valve disease prevalence. And third, to project changes in prevalence of valve disease based on the changing demographics of the US population. Our goal for PREVUE Valve was to focus on older Americans, and specifically wanted to enroll in a random sample of 65 to 85-year-old individuals who are representative of the US population. As such, the study had very broad inclusion criteria and virtually no exclusion criteria. The inclusion criteria was that the individual had to be between the ages of 65 and 85 and willing to provide basic demographic information. The only exclusion criteria was the presence of complex congenital heart disease. As you can see, this was a very, very real-world study. We could not have performed the PREVUE Valve study without key contributions from a number of study partners who are summarized on this slide. In addition to the Cardiovascular Research Foundation, our partners here included CVS Health and Walgreens, who were responsible for patient recruitment, Hawthorne Health, who performed the operational aspects of the study, the Columbia University Department of Biomedical Informatics, Vanderbilt University Biospecimen Bank, and the University of Michigan Survey Research Center, a very diverse and essential group. This slide summarizes the study overview, which is quite unique. This was a decentralized study. In other words, there were no specific study sites. We used both CVS and Walgreens pharmacies and their databases to identify, sample, and recruit by a combination of email, text messaging, and direct mail a random sample of individuals aged 65 to 85 in the United States. Very importantly, to enhance participation and representativeness, which was essential to our study, all study visits, including performance of a complete 2D echocardiogram and 12-lead EKG, were performed in the participants' own homes. All echocardiograms and other study procedures were then interpreted by a core laboratory at the Cardiovascular Research Foundation, and again, very importantly, participants with clinically significant findings, such as those shown at the right, which are actual echoes from PREVUE Valve participants. They were notified about those findings in order to ensure that they achieved proper follow-up, and a number of patients actually underwent valve procedures as a result of being detected in the PREVUE Valve study. The primary endpoint of PREVUE Valve was the population prevalence of moderate or greater valvular heart disease and its individual components. We also had a key secondary endpoint where we expanded the definition to clinically significant valve disease, where we included mild to moderate regurgitative disease on the basis of the fact that previous observational studies suggest that these patients have prognoses that are very similar to patients with moderate disease. Population prevalence was calculated for the overall study cohort and then stratified by age categories, sex, and race and ethnicity. We also looked at the continuous relationship between prevalence and age, which was modeled using logistic regression with age as a spline to account for nonlinear effects. And finally, and very importantly, by working with the University of Michigan, formal statistical weighting techniques were used to reduce bias in all of our prevalence estimates and to calibrate these prevalence estimates to the US population. This slide summarizes the study flow. A total of 8,291 individuals responded to our initial outreach and visited the study portal. Of these, 3,397 completed screening and informed consent, and of those, 3,000 underwent the home visit and all study procedures, which constituted the primary analytic cohort for our study. I'm very proud of this particular slide. This shows the geographic distribution of all 3,000 study participants in the PREVUE Valve study. The first patient was enrolled in Conshohocken, Pennsylvania in April 2022. The last patient was enrolled in Georgetown, Texas in March of 2025, and in between that we enrolled participants from all 50 states, including Alaska and Hawaii. This slide also is something that we take great pride in. This compares the study population to the US population, age 65 to 85. And what you can see is for virtually all characteristics, the PREVUE Valve study was very representative of the US population. 30% of the study population was over the age of 75. 57% were women. 15% were Black. And a little over 9% were Hispanic, virtually mirroring the prevalence of these characteristics in the US population. Now we'll turn to the results. The primary results of the PREVUE Valve study describing the prevalence of greater than or equal to moderate valvular heart disease are shown here. The overall prevalence in the 65 to 85 US population was 8.2%. You can see that that ranged from about 5% in the patients who were 65 to 69 years old to nearly 15% in the 80 to 85-year-old age group. If we look at age as a continuous relationship, one could see that there was a graded relationship in both men and women, but the effect was stronger in men. There was about a 5-fold increased risk of moderate or greater valve disease in men across the 20-year interval covered by our study, whereas for women it was about a 2.5-fold increased risk. When broken down by specific valve lesion, to our great surprise, moderate or greater tricuspid regurgitation was the most common lesion, followed by aortic stenosis, mitral regurgitation, and aortic regurgitation. As shown on the right-hand side, the relationship with age differed by valve type and was strongest for aortic stenosis, but also for tricuspid regurgitation, with a different relationship among men and women. The men, the prevalence really took off at about age 75, whereas the women were much more constant throughout the age range of our study. Finally, this graph shows the absolute prevalence, the number of individuals affected by age and sex. And based on current US demographics, we estimate that there are more than 4.7 million individuals in the United States currently living with moderate or greater valvular heart disease. About 1.3 million of these, based on our study, are severe, and about 60% are female. You can see that women predominate at all age ranges, although the gap closes as we get somewhat older. Shifting now to the secondary endpoint of clinically significant valve disease, the overall prevalence in the 65 to 85-year-old population was 18.4%, ranging from 12% in the youngest cohort to over 30% in the 80 to 85-year-old group. Again, the dominant form was tricuspid regurgitation, now with mitral regurgitation pulling in second place, and a dead heat between aortic regurgitation and aortic stenosis. When these relative prevalence rates were converted to absolute prevalence, the absolute prevalence of clinically significant valve disease currently in the US population, 65 to 85, is roughly 10 million individuals, about 2.1 million of whom have severe disease, and nearly 2/3 of these individuals are women. The second analysis that I mentioned focused on the impact of race and ethnicity on any valvular heart disease. And after adjusting for age and sex, we found that Black individuals had about a 21% lower prevalence of valvular heart disease in the United States compared with non-Hispanic white individuals. And as you can see from the individual valve types, this was driven exclusively by aortic valve disease, both AS and AR, which were lower in black patients than in white individuals. In contrast, there was no evidence of an association between Hispanic ethnicity and the prevalence of any valve disease, although there was a suggestion possibly of lower degrees of tricuspid regurgitation. Finally, projected prevalence from age 25 to 2060. We used the US Census data to project these changes. Overall, the number of people with moderate or greater valvular heart disease is projected to increase by about 1.8 million over the next 35 years, with the growth being by far the largest in the 80 to 85-year-old age group. Similarly, if we look at clinically significant valvular heart disease, we project an overall growth of nearly 4 million individuals, again, driven largely by the oldest cohort. Our study does have several important limitations, and in particular, our findings are likely to have underestimated the total prevalence of valve disease among older Americans for several reasons. First, by design, we excluded individuals over the age of 85. Just knowing how many individuals there are over 85 and making some extrapolations, we can project that this would, if we had included them, we would have likely had 10 to 15% higher absolute prevalence rates. In addition, there's good reason to believe that patients with known symptomatic valve disease are likely to have been underrepresented in our study because many of them are already under care and undergoing surveillance echocardiography. And therefore, I think for these two reasons, we can say that our findings likely represent a lower bound of the true prevalence of important valve disease in the United States. And finally, I think AR is a bit unique and is likely to have been underestimated more than the other valve lesions, mainly because of known limitations of transthoracic echocardiography for assessment of aortic regurgitation. So in summary, ladies and gentlemen, among Americans aged 65 to 85, the prevalence of moderate or greater valve disease is a little over 8%, which increases to more than 18% when individuals with mild to moderate valve disease are also included. This means that there are at least 4.7 million older Americans living with moderate or greater valve disease and at least 10 million living with clinically significant valve disease. Importantly, many of these individuals, most of them in fact, are unaware of their condition. The prevalence of valve disease increases sharply with advanced age, particularly for tricuspid regurgitation and aortic stenosis, with a somewhat greater effect in men. Nonetheless, nearly 2/3 of all older individuals with significant valve disease are women. The age and sex-adjusted prevalence of aortic valve disease is lower in black patients than white patients. However, these differences only explain about half of the undertreatment rate that we currently see in US practice. And fourth, based on these findings, the number of older Americans with clinically meaningful valve disease is projected to increase by nearly 4 million by 2060, driven largely by a substantial increase in the 80 to 85-year-old age group. And finally, and I think most importantly, PREVUE Valve demonstrates the power of novel approaches to recruit and enroll individuals who are broadly representative of the US population in clinical studies. I am hopeful that application of these concepts to future clinical trials will have the potential to greatly enhance the generalizability of our findings to the full spectrum of affected individuals. Finally, I just want to acknowledge all the people with whom I could not have executed this study, in particular our steering committee and my co-investigator, Mickey Brenner, all of the core laboratories, study management and statistical analysis, both at CRF and the University of Michigan, our very critical study partners I already mentioned, and of course, all 3,000 participants who volunteered to participate in the PREVUE Valve study. Thank you so much.
Congratulations on this truly exceptional study. And now to discuss the study, we have Dr. Prendergast.